Welcome to Brazos Valley Charting, and congrats on becoming a scribe. This will be a great opportunity for you to grow in medical knowledge and in clinical experience. In these videos, you will be provided with a brief description of what you will be doing as a scribe. In your formal training, you will get more information, but these are intended to facilitate that process, so please pay close attention, take notes if needed, and save any questions for your trainer. First, a few details about the job. It is important to note that scribes will be working in a 1-to-1 ratio with the doctors in the ER. It is your job to document valuable information about the patient, so be sure to be attentive and pay close attention to detail because accuracy is very important. In the ER, all of the charting is done through an electronic system known as Pisces. You should be getting information about your username and password at some point, and you'll be able to access this site on your first training shift with that information. You can see Pisces is pulled up right here, and I'm just going to go ahead and log in using my login ID and my password. Now, this is called the main screen. Let's go over some details about this main screen in front of us. You can see the patient's room number, their first and last name, their age, their complaint, their doctor, the scribe, and the nurse. And once your doctor that you're working with has clicked on a patient, then you are free to click in this area right here to assign yourself as well to that doctor. But make sure you do so after the doctor has clicked on the patient. Okay, here's their primary medical doctor is listed if they have one, any various orders, their disposition if it's been decided, and any comments that relate to the patient. There are also many different views that you can use. You can see that right up here. You can see patients in ER3, ER3, Express, the main ER, so you can determine which view is appropriate so that you're only seeing the patients that are pertinent to what you're doing versus being overwhelmed with a lot of extra external information. Now, let's look over a generic chart with fabricated patient data. I'm just going to go ahead and click on this chart here, and you can see there are many tabs associated with the chart, some of which you will use all the time and others which you will almost never use. We'll go over the main components of the chart in these videos, but I would recommend that on your free time you go through and look at each tab to make sure you know what it's talking about. The first thing we see is the triage note, which I actually use a lot. You can get some valuable information about the patient's complaint in this area right here. Then we have our current medications tab, which I also use a lot too. That will list any medications that the patient is taking at the time. So you can see that right here. This patient doesn't have any. Here you can see the ROS, or the review of systems, and the physical exam, or known as the PE. These two things we use on every chart, and we'll talk about those in the upcoming videos. Here's past medical history, EKG interpretation, radiology interpretation, doctor's notes, scribe documentation verification, and diagnoses. And those are just the main ones that you'll use as a scribe, but you'll use the others at some point too. We're going to be discussing all of these tabs in further detail in the upcoming videos. But let's go ahead and note at this time that on every chart you're going to need to insert a CYA note to protect the doctor, sign a scribe documentation verification, and insert a lab disclaimer. Your scribe trainer will instruct you on how to get this set up, so you don't have to worry about them at this time, but simply know that it is there and expect to talk to your trainer about it during your training. One of the things I just mentioned was the scribe documentation verification, which is done on every chart. It's very simple, and the way you do that is you just click right here, click yes, and click enter. And that's all that it takes. And you can see now that it's all complete over here on the left side. As a scribe, you are responsible for 3 main components of the chart, as well as supplementary data. Those 3 main components are called the History of Present Illness, or the HPI, the Review of Systems, or the ROS, and the Physical Exam, or the PE. Here are the ROS and the PE, which we've already looked at just briefly earlier. First, we're going to be starting with the HPI, and that will be in the next video. Thanks for listening.